All right, I'm going to do a visceral assessment or a visceral listen on my client Chelsea. We've already gone through explaining the process, and we got permission to do all this, and so here we go. So first thing I'm going to do, I'm just going to stand behind you, Chelsea, and I'm going to place my right hand on top of your head, left hand on your back, and I'm just going to apply a little bit of tiny pressure on your head. And as I do that, I can see and feel a little bit of a lean to the left. Now, if I do this again, and I'm going to palpate the side of your body here as I do so. Now, I'm going to put pressure here, just over like the stomach area, and do the same thing. And I don't get a lean. Try back here, still get the slightest lean. So when I put my hand over your stomach, it seems like your stomach is likely implicated or something in that region for that fascial tension that's pulling you that way. Now, can I get you to lay on the back? Good. Now I'm going to do another visceral listen. So I'm going to put my hand right down near your pubis symphysis here. Is that still okay?
Yes.
All right, so I'm just going to put a little bit of pressure into your abdomen and see where my hand wants to get pulled by the fascia. Now, coming up the middle line of your body, I don't feel a lot of pull. I'm going to come up the right side now. That feels pretty good. I'm going to come down here too. Maybe the slightest pull into the right sort of inguinal area there. Now I'm going to come up the left side. Slight pull again into that sort of inguinal area there. Now as I come up, I can feel a little bit of a pull right here into the region of your stomach that came up on the standing listening test. Now I want to see which lesions are prioritized here. So I'm going to start low. So I know there's a bit of a pull down here into the left sort of inguinal area. So if I put pressure here, you can feel a pull in. And then when I touch here, do I feel the same pull? And I feel a little bit of a pull still into the stomach area. So it tells me the stomach has a greater effect or is more of a priority in treating. And I'm going to try the same over here. So I'm going to put my hand down here where I feel a slight pull down to the inguinal area. And then when I touch here, I can still feel a stomach pull. And we can try that in the reverse way too, where I feel a slight fascial pull that way. And when I touch down here, I still feel a little bit of a drag into the stomach region. So we're going to try to treat this with a few different methods. First thing we're going to do is a bit of Chapman's reflex points. So with Chapman's, there's going to be some likely tender spots on the left intercostal spaces between the 5th and 6th and 6th and 7th ribs. We're going to do some gentle circles there, and then flip her over, same area but on the posterior side of her back. We're going to look for tender spots too between the 5th and 6th and 7th spinous processes in the transverse processes. So I'm trying to sit on a bit of an angle so I don't totally wreck the camera view here. I think. So first rib is here right underneath the collarbone. I'm going to come down, find your second rib, third rib. I like to palpate on both sides to make sure I feel it better. Fourth, and the 5th and 6th rib right here. So I'm just going to put a little bit of pressure in this area here. Does that feel okay?
Mm-hmm.
And then I'm going to come right below here. And that one's a little bit more, probably more tender, eh? Or it feels a little bit tighter to me. How do you feel?
I bet that last one was a little.
Oh, the previous one was more tender to you? Yeah.
Yeah.
I can feel a little bit more kind of thickness in the tissue here. Okay, can I get you to roll onto your stomach? And then I'm going to have you, would you turn your head to one side for me, please? And then back to center. So that helps me to find C7. Which means T1 is right here. T2, T3, T4, T5, T6. And then I'm going to put some gentle pressure here on the left side. Some gentle circles. How's that feel? Is that okay?
Tender.
A little bit tender. Okay. I'm going to come down here. Yeah, that one doesn't feel as tight as the one above to me. Now, can I get you to lay on your back? So we're going to do 3 cycles of this as long as it feels like there's still tenderness and tension in that area. So let me not block the camera too much. Find your second rib, third, fourth, fifth, and then get into the space there, that's your costal space. Just little circles with my finger. It feels a little bit looser than before. And then, yeah, this feels a little bit looser to me too. How's it feel to you? About the same?
Yep.
Yeah. Can I get you to lay on your stomach again?
Mm-hmm.
I just want to make sure I'm on the right spot, so would you turn your head straight down? Yeah. And then would you turn your head to the one side? Yeah, there's C7, so that's T1. 2, 3, 4, 5. And again, between the 5th and 6th intercostal spaces there. Sorry, between the spinous process and the TVP. I mean to say. Come one segment down. All right, we'll do one more time of those, and then we'll check to see if there's any kind of change, any release there. 2, 3, 4, 5. So I'm going to put pressure right there with my finger. And then I'm going to come down between the 6th and 7th, again doing little circles. Again, to my finger it feels like there is some loosening happening. And then one more time. Can I get you to lay on your stomach? And we're going to, again, landmark that spot. So I'm going to get you to turn your head to the one side. Okay, so that makes it T1, 2, 3, 4, 5. So I'm going to just put a little bit of circular pressure on that spot. And again. Okay. All right, can I get you to lay on your back again? So I'm gonna retest here just to see if I can still feel a fascial pull, and I still can get a little bit of a fascial pull up into the stomach area. So next thing I'm gonna do is I'm gonna slide this way a little bit, and we're doing a listening technique where I'm gonna put my hand over top of your stomach and sort of assess the motility of your stomach. So I'm just gonna put a light little pressure here, sort of lower end of your rib cage. And I can feel my hand move superiorly and laterally with what's called inspiration, as far as the organ goes, and then inferiorly and medially on expiration. I feel like it wants to move a further distance into expiration than inspiration. Now, we're going to treat the celiac trunk here. We're going to just treat the vascular supply and neurological to some degree to the stomach. So I'm just going to apply a little bit of pressure here, right below the xiphoid process, while making contact with the stomach with my opposite hand. And I'm just going to let my fingers kind of fall towards your spine. And just letting the fascia unwind in case there's any sort of obstructions to flow happening in that area. I can feel my fingers turning clockwise as they fall downward. Or something there. That's just releasing her. I'm not gonna make a joke. Alright, so I'm gonna slow down nicely. Okay, I'm satisfied with that. Now we're going to work on the mobility of the stomach. So I'm going to put my hand over top of the stomach region here. Just going to make sure I kind of got it and feel the motility of the organ. Now can I get you to roll over onto your left side? And as she does so, I'm just kind of scooping the organ a little bit, the stomach. And you can even lean forward a little bit more, and then I can feel like your stomach wants to fall out into my hand. And then I'm just going to see which way the stomach wants to move. Actually, in this position here, I feel like it goes a little bit more easier towards the midline of your body. As I try to rotate it, counterclockwise and clockwise, it prefers clockwise motion. So I'm going to hold it there. And then superior, inferior, it wants to come down. So I'm just going to hold it here for a moment until I feel a tissue release. Things will loosen up there a little bit there. So I'm now going to just move the organ in the opposite direction. That feels nice and easy now. And looking, go greater at ease, actually going counterclockwise like that. And superiorly and laterally now. Just hold that for a moment until I feel further release. gonna slowly come out of that. Now, can I get you to lay on your back? And I'm gonna recheck the fascial tension in that area. So I'll put my hand right here, pushing down, and I don't feel a pull any longer into that area. But I also thought would treat the sympathetic part of your stomach innervation. So I'm going to palpate between T6 and T9 on the thoracic spine. So I'm going to start way up here. And then Chelsea, can I get you to turn your head one way? There you go. So that's C7 I can feel there. So T1, 2, 3. Can I get you to roll this way a bit? 4, 5, 6, 6, 7, 8, 9. I'm going to put my fingers just off to the left of your spine there, and yeah, you can feel there's still some tenderness there, right? Now I'm just going to palpate the area of the stomach here. Waiting for those muscles to soften. There's some softening there. How's it feel? Is it any less tender yet?
Mm-hmm.
Good. Yeah, it feels like I just felt something release there a little bit more. I'm going to slowly slide my fingers out. And now I'm going to treat the parasympathetic system in the vagus nerve. So right where your sternocleidomastoid muscle comes down on either side. Can I get you to turn your head left and right? Okay, good. And then the other way, good. And then back to center. So I'm going to put light contact here between the sternal and clavicular heads of your SCM, because your vagus nerve runs deep through there, and I'm encouraging release of any fascial tension along the vagus nerve, and helping to restore proper parasympathetic connection and function with the stomach. I feel softening here. And while I'm on your stomach too, I'm just going to kind of focus in on it. It's just feel the motility of it. And again, it feels improved. I can feel like there's greater movement. It feels like in either direction, both superiorly and laterally, and also inferiorly and medially. As it comes up like that, it seems to move a bit posterior and a bit anterior as it drops. Now I'm also going to just quickly do like a global technique. I'm just going to do hold one with my index and middle fingers over the SCM to just further release that area just for a moment, and then we'll recheck the test we did earlier in standing. I'm just gonna hold up the best angle. Right? I mean, feel like it, again, like just tissue softening under my fingers as I have my fingers on your SCM on the other side. Now we're approaching the 20-minute limit, so when you're ready, Chelsea, can I get you to stand up again?
Mm-hmm.
And then I want to retest if I get the same sort of lean. So again, I'm gonna right hand on your head, left hand on your back, and apply a little bit of pressure, and I don't get that same lean of your torso. So looks like your stomach was complaining. We did some work to try to resolve that, and now I'm gonna take a look off camera here again and redo her Spencer's assessment to see if there's any changes in the way her vertebrae are aligned, etc. Bye.